After 20 years of infertility, this woman and her husband finally brought their baby home. I want to tell you about one of the beautiful stories of functional medicine, which combines both standard allopathic Western medical procedures and treatments with holistic root cause testing and replacement and balance. So, this woman started seeing me back when she had been trying to conceive for 16 years. And she had already gone through 2 rounds of IUI that were unsuccessful. That's intrauterine insemination. They had already found that her husband had a low semen quality, various markers, and attempted to treat that with supplements for him. And we had started with various complaints that she was also having. Her hair was falling out on her head. She had some facial hair growth. She had some depression, mood disorders, and other various symptoms. So, along the lines of helping her with her health as well as her goal of conceiving, she had 2 hysterosalpingograms, which are designed to test but also open up the fallopian tubes. So, that had already been done. With my care, we found some hormonal imbalances. They weren't severe. She didn't have a simple progesterone deficiency or lack of ovulation, but she did have some of these characteristics of PCOS. We found some erratic LH FSH patterns and some luteal phase irregularity with daily hormone monitoring. Very helpful. We found that she had low cortisol or adrenal insufficiency on her Dutch test, dried urine test of comprehensive hormones, as well as confirmed on serum lab testing. We found that she had autoimmunity with a raised ANA, not severe, so maybe not a Western medicine clinical diagnosis of autoimmunity, but it was an elevated titer. We started some holistic therapies to support that, as well as low dose naltrexone, which can be used to treat autoimmunity as well as infertility in general. We found some food sensitivities and she started to avoid those, some nutrient deficiencies that we replaced. We found inflammation with a high CRP, so we started some supplements and therapies for that, turmeric, things like that. We found that she had 1 copy of the MTHFR gene, which is not supposed to cause problems. You can have 2 of 2 copies, which would be the most significant scenario, but she had just had 1 copy, but we still supported making sure that she had methylated B12 and folate. We did a vaginal microbiome test with the EV test, EVVY, and found some imbalances there that were subtle. That's called subclinical vaginitis. So we treated that with vaginal boric acid. What else? We were doing licorice in the morning for her low cortisol. It wasn't so low that I considered synthetic hydrocortisone, but it was low enough that I did want to correct it to help her overall health. So, and then we did use some progesterone to support her luteal phase. Along with all of this, she then went back by my recommendation for intrauterine insemination again, because now we had balanced, corrected, replaced all of the things that were in her overall health. Her overall health had improved. She went back to IUI with another fertility specialist, not myself. They did some more rounds of testing. They got her husband on some more specific therapies because his counts were still low. And she had a successful implantation the first round. They just welcomed their baby home this month. So 20 years of infertility, they have their baby. This is not just fixed by hormone balance or taking a vitamin. This is multifactorial. Sometimes it's really complex. The journey might take a while, but they have their baby. And the journey is just beginning because now we have a new mother that needs all sorts of support. So just wanted to pass that along.